Well, thank you very much for that very informative presentation, Dr. Lim. We are now going to begin our Q&A. I'm sure we're going to have plenty of questions from the audience, would be my guess. And I have some questions too. We have about 13 minutes. So before we do, if you have any places that people can go to check out your, if you have a website or social media so people can follow you, learn more about you.
Yeah, the vast majority of the work I do is through the McDougall program. Currently, I've been medical director now 8 years. I see all my consultations through them. You can arrange a new patient consultation and determine whether maybe our 12-day program is a good fit. Yep, and we also have a free McDougall program. And in those consultations, I sort of assess patient suitability for the 12-day program. I will just say one of the benefits that patients have appreciated of the 12-day program is because then they're a patient for life. And so every week, part of my schedule is seeing patients who have done the program as recently as 1 month ago to 20 years ago, over 20 years ago, for follow-up. And what they say is that it's really hard to find medical doctors who you can trust these days. And so what I bring is a belief in the pillars and foundation of lifestyle medicine as the core, but then also open, I'm an MD, right? Open to the benefits of medicine as a secondary, medicines and surgery, as a secondary measure for when lifestyle has not fully helped a person. So, it's bringing both those worlds together rather than what patients feel, which is the reflex within the medical establishment to clean up the puddles while failing to address the root cause and turning off the faucet. So that's the best way to access me is through the McDougall program.
All right, great. Thank you for that. So we're now going to open up our live Q&A session. So I'll be asking questions if there's not audience questions. I see one already. And then we will, and then we'll go from there. So real quickly, we'll be, let's see here. We don't take questions from the chat directly. What we'll do is ask the audience to raise their hands in Zoom. To do that, at the bottom right of Zoom, second to the right, actually, you'll see an icon called reactions. You'll click on that, and then you'll select raise hand. Okay. And we will then take questions in the order in which we receive them. When it's your turn, I will unmute you, prompt you to state your where you're from and ask your question. We ask that everyone keep their questions brief and on topic. We will then mute you in order to give everyone a chance. We'll ask that you just ask a single question without follow-up. And if there is time, then you can go ahead and raise your hand again and get on the back of the line. And if we have time, we'll answer that as well. So I see we have a question from Wendy. So Wendy, please state where you're from and ask your question.
Hello, I'm calling in from Boca Raton, Florida. It's so gorgeous out here. My question is, so let's say you're trying to get rid of an addiction. For me, it's a coffee addiction. And I feel like you caught me, that coffee and vegan sweetener is like, it's a real addiction. So you're trying to release something from your body, and then it gets caught up in your bloodstream, recycles, and makes you crave that very substance. So how do you break that cycle?
Yeah, so great question, Wendy, and gets to the heart of a lot of the conversations I have with my patients. The very first thing is what you've already shown that you're moving towards, which is awareness. Right? You cannot cure or fix what you are not willing to acknowledge and accept. And it may seem sort of second nature that you've already acknowledged it, but for many, their ego, right, stands in the way. It is very hard for people to acknowledge what Carl Jung calls the shadow. And the shadow is that aspect of ourselves that doesn't like to be, and those parts of ourselves that they are part of who we are, but we don't want to acknowledge or accept it. And so we deny it and repress it. So the more that you can bring to light the truth of your dependencies on things like those vegan creamers and the coffee, that is gold. Okay. And so what I encourage you to do is now take that awareness and then start to notice also, just kind of sink in, like, I'm feeling that urge for that coffee with creamer. Like, what am I experiencing? What's going on inside? What emotions am I feeling? And maybe, who knows? I mean, this is kind of part of the process. You may notice that you're feeling whatever, a sense like, I deserve it. I deserve a treat, or I deserve something like some pleasure or something. And you just start to notice what the emotions are that arise. And then really with that awareness of the behavior, the habit, the emotions that are arising, is starting to ask yourself, is there another way that I can meet this need of mine, or these emotions of mine, or this restlessness of mine, or this stress or anxiety of mine, in a way that does not involve this food, which I know to not be serving my long-term interest? That's the core question. It's sort of replacing with something not that can meet that need. And so, for example, I mean, there's so many. This is again where the uniqueness of each person comes out. I'll just give you some examples, though. Some people it's meditation. Some people it's prayer. For prayer is a huge one for people from whom spirituality. Going for a walk, in, ideally in nature. There's so much in terms of studies about the effect of nature in terms of stress coping. Playing music or singing songs. Talking to someone who you trust. Journaling. My journal, right? Pages and pages. This is, where a lot of my thought. All of these, it has to be something that is aligned with the direction that you want to head in, right? But that's kind of where it is. It's awareness, and it's sort of setting an intention for a different kind of behavior that you're going to engage in when that craving comes up, right? And then it's actually putting it into action, and then it's reflecting on it, seeing, hey, how did that go? And maybe, it doesn't work all the time, but over time, it starts to get better and better and better. And you find those set of behaviors that suit you more and make you feel more whole.
Great. Thank you, Doctor. Our next question is coming from Bobby. Bobby, please state where you're from and ask your question.
Hi, yes, my name is Bobby and I live in Chicago. I'm happy to say that the weather is nice right now. And I have just enjoyed your presentation so much. I really appreciate also at the beginning that you talk about that it's a dietary journey. And I feel like I've definitely been on that. And now I don't have sugar, salt, oil for the most part, flour. But one thing that I'm working on is my blood pressure. So the transformation stories that you shared, super, super inspirational. And I'm hoping to eventually be free of blood pressure medication. Also, a couple of years ago, when I was first diagnosed with high blood pressure, the doctor did an echo 2D Doppler test. I don't know what you call that, but the left ventricle was normal in size, but there was moderate left ventricular hypertrophy. And I'm just wondering, is that something that over time that can reduce? Like, can it go back to normal, or is that something that is permanent usually?
I think that it's very possible that it could improve.
Okay.
I think it's unlikely that your left ventricular hypertrophy would, basically return to its sort of original state. But we know from the studies that cardiac health can be improved. The works of Dr. Ornish and Dr. Esselstyn and all the pioneers who have come before us. But oftentimes in those studies, it's not that it's not that age-old plaques disappeared, right? There may have been some plaque reversal, but some of it was just so almost like scar tissue. And so I would say the goal is not, in your mind, I would sort of reframe the goal. The goal is not that I, no longer have left ventricular hypertrophy, but the goal is that I make a significant enough change to the way I'm eating and my overall lifestyle that I can cure myself of high blood pressure, because the high blood pressure is why you've developed the left ventricular hypertrophy in the first place. And then by addressing it at that root cause level, now my heart's not going to have to be working as hard. The left ventricle is not going to become as, hypertrophied. Maybe it'll even relax a bit and diminish in thickness a bit. And I can rest easy in the fact that I'm doing everything I can to optimize my overall cardiac health and minimize the likelihood of suffering a premature heart attack or stroke or other cardiovascular event in the future. And I think that's a realistic, very doable goal.
Great. Thank you for that answer, Doctor. So one quick question, because we just have a minute or so left. You mentioned cholesterol less than 150 is ideal. We've had different doctors on thus far. This morning we had Dr. Gabriel Cousins, who thinks that that the research shows that cholesterol should be higher for brain health.
Mm-hmm.
Where do you stand on that? What does the research show with regard to cholesterol for heart and then also cholesterol for mental functioning as well?
Well, I would be interested. I mean, if there's actually research that shows that higher cholesterol has led to better brain health, I've not seen that study. And I will say that just in my experience and based on the research that I've seen, that the people most of the time who are eating the very clean whole food plant-based diet, what we see is dramatic drop in total cholesterol, oftentimes down to less than 150. But I'm also careful. There's a small percentage of patients, I'd say I don't know the exact number, but if I just had to roughly guess, 10% or less, who despite eating an optimal diet, plant-based diet, are still might have these high cholesterol levels. And in their case, theirs may be genetic. I will say in all my years, I haven't had a single one of these end up having a cardiovascular event. And it's a reminder not to let any one thing become the end all be all, right? Cardiac health is a composite of so many factors, including our BMI, our blood pressure, our blood sugar levels, our stress levels. We even know that, how connected we are impacts our cardiovascular health, or whether we have depression or not. So just kind of having that perspective that I've told these patients, I've literally told some patients who have these high cholesterol levels years and years, and they've made their whole life focus on this. I said, I think maybe you need to stop checking your cholesterol level. You're doing everything right, and everything else looks good. So I would start to let that go, and that's brought them great peace of mind. So I still generally subscribe that off medication, the lower you can, the better. And I haven't seen research to suggest that you actually want higher cholesterol levels for brain health, but that's just my experience.
Okay, great. So with that concludes our Q&A, and we really appreciate all the information that you gave and your perspective on holistic health. So real quickly, I'd like to give everybody in our audience the opportunity to share their appreciation with you. We're going to open up the mics, and you're going to hear a whole cacophony of thanks.
Yeah, there is.
Thank you, Dr. Lim. You're awesome. Love you.
Great height.
Amazing.
Thank you.
Great. Thank you so much.
Thanks.
Fun. Love it.
Yeah, it's a little crazy.
Yeah.
All right.
I'm very filled by your love. Thank you.